Promoting education and understanding about sexually transmitted infections is vital to initiate open conversations about sexual health. Such discussions play a crucial role in reducing stigma and misinformation surrounding these health issues. By raising awareness among the general public and healthcare professionals, the significance of regular testing and treatment can be emphasized. This empowers individuals to take charge of their sexual health, leading to improved public health outcomes. Journey with me, as we explore the importance of sexual health education, the impact of stigma and misinformation, influential figures in the field, and current initiatives aimed at increasing awareness about sexually transmitted infections. Sexually transmitted infections are a significant public health concern worldwide. The Centers for Disease Control and Prevention highlights that millions of new infections occur each year. However, the majority of these infections can be prevented or effectively treated with early detection and education. Education promotes understanding of transmission methods, symptoms, and the importance of seeking assistance. Knowledgeable individuals are likely to acknowledge their sexual health responsibilities and seek regular testing. For effective educational campaigns, it is critical to target diverse audiences, including adolescents, adults, and marginalized communities, ensuring tailored messages are disseminated to each group. Historically, public perception of sexually transmitted infections has varied widely. Early responses to outbreaks of diseases like syphilis and gonorrhea often focused on moral judgments and punitive measures rather than health education. This misunderstanding has roots in societal attitudes toward sex as taboo. Consequently, these attitudes fostered a culture of silence and shame. The Diagnostic and Statistical Manual of Mental Disorders once categorized promiscuity as a mental disorder, demonstrating how deeply misinformation can infiltrate public consciousness. Over time, health professionals and advocates began to shift the dialogue toward understanding these infections as public health issues, necessitating focus on education rather than stigma. Prominent individuals have made significant contributions to addressing sexually transmitted infections through education and advocacy. Dr. Ruth C. Yangs, an esteemed professor, pioneered sexual health education, making strides in destigmatizing conversations about sexual health. Her work helped open up dialogues within educational institutions, leading to the incorporation of comprehensive sexual health programs in schools across the United States. In recent years, organizations like Planned Parenthood have evolved to provide comprehensive sexual health services, emphasizing the importance of education and awareness surrounding sexually transmitted infections. Various perspectives exist regarding sexual health education in schools. Some advocate for comprehensive approaches that incorporate discussions about consent, sexual orientation, and gender identity. Their philosophy posits that open and honest educational frameworks help dismantle stigma and misinformation. Others, however, promote abstinence-only education. This approach often limits the discussions about sexually transmitted infections and fails to address the realities faced by young people. Evidence suggests that comprehensive sexual health education ultimately leads to better health outcomes as it empowers students with knowledge rather than fear. By fostering an environment where discussions about sexual health are normalized, students are more likely to seek assistance when facing potential health issues. The role of healthcare professionals is pivotal in promoting education around sexually transmitted infections. Providers must be trained not only in the medical aspects but also in communication strategies to address sensitive topics. It is crucial that they create safe spaces for individuals to discuss their concerns without shame. Initiatives that train healthcare professionals to approach conversations about sexual health can help ease patient anxiety. By normalizing these discussions within healthcare settings, stigma is reduced, encouraging individuals to seek regular testing and treatment. Many current public health campaigns focus on increasing testing and awareness, particularly in response to rising rates of sexually transmitted infections. The "Get Yourself Tested" campaign, for instance, emphasizes the importance of knowing one's STI status. Through social media, outreach events, and partnerships, the campaign aims to reach younger populations, raising awareness and breaking barriers associated with testing. By leveraging accessible platforms, these initiatives convey the message that regular testing is a critical aspect of sexual health. Furthermore, mobile applications and telehealth services are emerging as innovative ways to promote education and facilitate conversations about sexually transmitted infections. These digital tools can provide valuable information, resources, and anonymous platforms for individuals seeking guidance. As technological advancements continue, it is worth exploring how these tools can be effectively implemented into public health strategies to enhance sexual health education. Stigma remains a prevalent barrier to accessing sexual health services. Individuals often refrain from seeking testing due to fear of judgment or discrimination. This fear can be particularly pronounced in marginalized communities, where cultural or social factors contribute to feelings of shame. Addressing stigma requires a concerted effort from healthcare systems and communities. Inclusion of diverse voices in sexual health campaigns can help bridge gaps in understanding. Collaborative initiatives that involve community leaders can foster trust and create safe environments for discussions about sexual health. Moreover, the impact of the COVID-19 pandemic has underscored the necessity for ongoing education about sexual health. The diversion of health resources toward pandemic-related issues resulted in decreased access to testing and care for sexually transmitted infections. Public health professionals must respond to this challenge by integrating sexual health awareness into broader health campaigns. The lessons learned during the pandemic highlight the importance of adaptable educational strategies that can respond to emerging health crises while still addressing sexual health needs. Going forward, incorporating intersectional approaches in sexual health education remains imperative. Understanding the intersection of sexual health with other social determinants such as race, gender, and socioeconomic status can enhance education strategies. Tailored messaging that resonates with specific communities can lead to increased engagement and participation in sexual health initiatives. Public health campaigns should prioritize cultural competency, ensuring that language and mediums are inclusive. In conclusion, promoting education and understanding about sexually transmitted infections is key to developing open conversations about sexual health. Public health initiatives must strive to reduce stigma and misinformation, making room for inclusive dialogue. Influential figures and organizations play critical roles in reshaping perceptions and emphasizing the significance of education, regular testing, and treatment. As we look to the future, a commitment to comprehensive and intersectional sexual health education can empower individuals to take control of their sexual health. By raising awareness, we can forge a path toward improved sexual health outcomes in a society where conversations surrounding sexual health are normalized. 10 Down WJ, where creativity meets impact.